All right, welcome back, and we're inside Be Healthy, Be You. Hello, ladies.
Hey,
We're back.
yes, happy to be back.
I saw, I saw Nicole. I said, "How you doing?" And that's her family. We're Julie Brenda. she said, "Oh, they'll be back next month." I said, "Okay, because people, yeah, people,
I don't know. She should be at corporate headquarters about right now. So,
yeah.
Shakina. Well, see, now you really messed up. Now everybody knows Tasha and Shakina are one. Oh, live in the same body. Put it
Well,
that way.
welcome back, y'all. I mean, it's wow. I had to make up stuff on Tuesdays. I'm pretty good at it. But
Yeah, you were.
Yeah,
I
it
was
didn't.
listening.
We were. Yeah, I was listening too.
So
No, it's very good to be
Mr.
back.
Whiteout stepped up and stepped in, and yeah. So y'all had quite a
Yeah.
few.
Debo show.
Yeah.
yeah, I know it's life after, right?
Mhm.
Yeah.
Mhm.
So it was good. You guys be with us every first Tuesday.
Correct.
Yeah. So, wow, a lot has happened since we last talked last year.
A lot has happened.
Mhm.
A lot of medical things have happened too. This measles outbreak is
Oh, yeah.
important for vaccinations. And they said if you had your MMR, you don't have to worry about isolation. If you've been around
Mhm.
somebody that has measles, you're good. You're good.
Yeah, but it it also pushes to what pushes also this idea that you let people act on their feelings and beliefs, not based in fact or science, and
Mhm.
now you're dealing with the residual effects of that. We had basically eliminated measles.
Yes.
Right.
Yes,
Yes.
we had.
And so if people feel like, well, okay, it's my belief, your belief can get you in trouble. I'm sorry, I hate to be that guy, but now we're looking at a measles outbreak. I'm concerned about them. I think most doctors, most pediatricians are probably still going to suggest
Hmm.
that people, but for people who are probably outside or in a certain demographic, it was already difficult to get people in to get the regimens. Now, when they're kind of saying, "Well, you don't have to," they won't,
Mhm.
because they don't clearly understand the impact that illness can have or illnesses can have on their children.
You're so correct.
Right. And measles is not like chickenpox. Chickenpox can be very serious too. But, people die from measles
Mhm.
and they have long term, complications, hearing loss, fertility issues. Um, you know, there's all sorts of things. So it's not just like we used to think, oh, just a little childhood disease. You get it and you're fine. It has serious
I'm
consequences.
trying to remember if I had measles as a kid.
You probably did.
Probably did.
Mhm.
Yeah. And I don't know if it's again, these clusters, these outbreaks are in like rural communities, who have their own health challenges.
Hmm.
We talk a lot about, obviously, because we're in this space, we talk about the challenges that urban environments face, but really, in many instances, at least in urban environments, you have more access
Mhm.
Hmm.
to healthcare resources. Where depending on where you live, if you're in a rural area, you may or may not.
You may or may not, or you have to go so far to get it that it's like you don't have it. Mhm.
Yeah. So it's Black History Month.
It is.
Let me do this, and I'm not. You don't have to. I really thought about you too, when the nurse lost his life,
Mm.
and all of a sudden,
Yeah, it broke my heart.
but one of the you can. There's always some good that can come out of a situation. One, it alerted us to the work that nurses do, and particularly the type of work he was doing
Mhm.
at the VA,
Mhm.
Hmm.
and how important nurses really are. I've been going back and forth about, do I want to go into like the chaplaincy, but how difficult it is to go to a hospital. Just out with my mom. My mom went in ICU,
Hmm.
Mhm.
but just coming in the hospital. But you get a real appreciation of watching these healthcare professionals up close
Mhm.
and what they have to do, or you look at what CNAs have to do,
Mhm.
and I mean, and they go in and they clean people and stuff that I wouldn't want to run in and do.
Mhm.
Mhm.
And so, yeah, I thought about that just it in terms of just the importance of nursing and nurses. I know we do Nurses Appreciation Month, but I don't know if we can truly express how much we appreciate.
Well, I'm glad you
Thank
gave
you.
a shout out to nursing assistants and and people that take care of seniors in their homes. We need everybody, and CNAs are they can make a pretty good living,
Mhm.
and care for their family. A single mom that's a CNA, she might work. She will work hard, different hours, but she can raise her family. And you know, Bill Clinton mom was a nurse,
Hmm.
and they tend to know how to steer their children into higher educations. But but yes, everybody that cares for even family members that care for loved ones, that's hard work.
Very much so.
And just you hear this whole idea, the concept of the village,
Hmm.
and I see now, and I'm sure for my mother, it's come full circle.
Hmm.
Because when we were little, the care, and now the care that we have to provide,
Hmm.
and primarily my sister. So shout out my sister.
Yeah, she's
Um, that
awesome, awesome woman of God.
Okay, let's not go too far with this. We are talking about my sister here, so let's not. Boy, just got to take it. No, when Francine had to speak out at New Testament Church,
Mm.
they do that Tuesday, Wednesday when the men would come together, and so the late Oscar Johnson said, "Keith, I want you to introduce your sister." I said, "Oh, okay."
Oh, that's
So I got
nice.
up and I introduced my sister, and I preface it with, "Look, do not come up afterwards and tell me how well she did, because after all, this is my sister." And if you don't think sibling rivalries are real,
I was just gonna say
yeah, they're
sibling
they're very
rivalry.
real. Um, but no, I mean, to be able to do it in such a way, and we've been really fortunate on a lot of levels because, relatively speaking, my mom is in good health.
Hmm.
Certainly, when you take in factors like age. I know one time I went in for my wellness, and my physician, he was putting in the notes and he was saying it out loud. In very good shape for a man his age. I'm thinking like, here we go
What?
with old again. Just can't get away from being old, can I? I mean,
That's okay.
is it?
Hmm.
The other alternative is that you're not here, right?
Yeah.
Yeah, you could be
So,
dead. That we say.
uh-huh. Yeah,
You could be
heart won't be beating
We were having
anymore.
this conversation at the end of the program yesterday. I said, I'm going to stop when I'm doing eulogies, reminding everybody the church ain't going to die. It's like, here he go again.
dead.
But yeah, I mean, and being, and I know this is Heart Month, so really we would talk about that. We'll dive into that. But I just think in general, our health. So let me ask this question. And this is a kind of softball lob. How important is our mental health when it comes around to when it as it relates or intersects with our physical health?
Well, it's a program that I do. It's called uh, Healthy Brain Equals a Healthy Heart. If your heart is not functioning properly, your brain is gonna get have problems. Not only your brain, but that catches people when they realize that they can um, lose their form of intelligence or
Hmm.
um, but your kidneys, your heart is the key, and if it's not functioning properly, it can cause damage to major organs, but mostly your kidneys get it first,
Hmm.
and then your peripheral vascular, like your legs and your feet. And you see people with those huge ankles and you can see
Mhm.
it. You can, when you see that, you go, something ain't right with that heart.
Hmm. And sometimes when people start to show like signs of dementia, and people automatically go to the fact that it's a real memory issue or it's Alzheimer's or something like that. That's why you have to have a complete physical workup, because it may not have anything to do with your brain. It may be because you've got some clogged arteries, or like Julia said, your brain's not being fed enough because your cardiovascular system isn't working right, and those things usually can be fixed.
Yeah, can.
And so once that's fixed, then you start to see the improvement in the memory, and the higher functioning and all of that. So it's important. We sometimes just ignore, because yeah, she's getting old, she's got memory issues. It may be something cardiovascular related that could be taken care of.
And how things like infections can impact our mental.
Oh, for sure.
Absolutely.
Why they're delusional. Well, if you've ever had like a high fever and all of the hallucinations and everything that you're having, so a lot of times being able to kind of identify it, recognize what it is, certainly seeing your doctor. And I'll be honest, when I had to go in for what we had did a they do a health screening, um, through the city of Milwaukee. Rhonda gets a discount for her health insurance if you hit certain points. And so when I went in for the screening, all those things were really good, glucose, all those things. But then I knew I had to go see my doctor. And what I'm really worried about is PSAs.
Your PSA.
Yeah. And I was like, okay, glucose is good, because I'm not a big sweet eater. I do. And I was just telling someone how difficult it is to count calories. But I was really worried. I was like, man, here we go.
Did you pass?
1.4.
You passed.
Yeah, that's pretty low, right?
And
it could just come out of nowhere.
Yeah,
so.
It can, and it's important though you get it checked, because the earlier it's much better outcomes.
And it doesn't necessarily mean cancer with a
Right.
man. With some prostate issues are just enlargement and inflammation and stuff like that. And you just need to make sure the doctor will let you know. They have ways of treating it. But when we talk about heart and brain, there are a lot of electrolytes that if your sodium is up and calcium is off, and all that kind of stuff can cause you to be totally confused. Bladder infections. Our seniors are
Oh my gosh.
historically known for having a bladder infection. And as soon as they start talking loopy, you need to
go say possible UTI.
And I noticed that with my mom, it's like, oh, she's just not here. And it's like, but what it is her body is trying to fight that infection. And so when the body fights, you guys explain this to me. So what does it mean when your body's fighting infection?
Well, your immune system is, like Julia said, releasing all those little soldiers.
Your white blood cells are
They're running
marching
to
out.
the spot.
We're
Yeah.
marching.
Yeah.
Beautiful.
Yeah. So they're going there to take care of
Yes.
things. And then, you get some inflammation. You get a temperature. All of that is your body's immune system trying to deal with this infection in a good way. It doesn't feel good, but if it goes unchecked, it could be really bad. But it's there to
What's that song? War.
Ooh,
good for
absolutely.
Nothing.
Say it again now.
war.
So your body is at war.
Yeah. And it's trying to fight that infection,
Yes.
right? That invader that's come in the body. However, sometimes some of the other systems maybe take the hit too, because it's trying to get rid of that thing that's not supposed to be in the body.
Let me deal with my rudimentary understanding of medicine. So what happens, like, when kids were getting scarlet fever, that impacted the heart, right?
It can be the inflammation can go on and damage the heart.
Are there other like viruses out there that can have particular impact on the heart?
Well, dental. That's
Mhm.
why they want you to take antibiotics if you are going to have certain dental surgery, especially if you have heart disease already. The
Mhm.
people have the valve replacement.
Yes.
They definitely want them to
Mhm.
have antibiotics series before they go for dental work.
Mhm. And if you have really bad dental hygiene, a lot of cavities, a lot of inflammation in your gums,
Bleeding.
yeah, any of that, they're not going to do an elective surgery until they can clear that up. An emergent surgery is different. They don't have a choice. But for an elective surgery, if you need a knee replacement and your teeth are, it's not going to happen.
So, and I think we certainly, J.D. Vance's book, Hillbilly Allergy, he
Mhm.
introduced a term that I had never heard before. We talked about it before,
Mhm.
Mountain Dew
Mountain
teeth,
Dew teeth.
and how it's having impact on the heart.
Mm-hmm.
And that
Mhm.
a lot of people don't realize how much your dental health impacts, like your heart, infections in the body, and things
Mhm.
like
It
that.
is
Mhm.
so
If
serious.
your mouth is for lack of a better term, jacked up, right? If you've got a lot of infection, inflammation, you're gonna have inflammation throughout your
Mhm.
body. So it's not just localized there; it's causing issues throughout your entire body. And so that's why oral care is so important. Seeing your dentist as a part of your medical care at least twice a year for cleanings. Some people, especially some people with diabetes, may need to go every 3-4 months
Mhm.
instead of every
And
6
it will
months.
be paid for.
Hmm.
And you know, when you go to your eye doctor, and now dentists are starting to take your blood pressure
Mhm.
Yeah,
before
mine
they
does.
do care.
Hmm.
And if you go to the eye doctor and they go, you need to see your doctor. 'Cause
Then you
they
kind
can
of get
see-
scared, right? Uh-oh.
They can see them vessels behind your eye.
They should obviously take Julia Means' seminar on how to break bad news to patients. Julia has such a great bedside manner.
Your blood pressure is
No,
high.
you didn't do it like that. That woman, you were just going,
Well,
"Oh,
that's
it's
because
just a
that's
little
because she was out
high."
in public with everybody.
You need to
Julia can
see
tell a
your
person
But
their
doctor.
blood pressure is
I
high.
have called. We'll get you right across the street. We're inside Be Healthy, Be You. They're back. Miss Julia
Yes.
Means, Miss Brenda Buchanan, Ascension of Wisconsin. We're going to take a quick break. We'll be right back. like not one, not nearing one,
Not now.
not nearing one. This is Black History Month. So I think as we talk about, it's also Heart Health Month. Um, we think about people who've had impact certainly on the heart. Wasn't it Daniel Hill?
Which did what?
First open heart
Oh, let me
surgery.
see.
Yeah. Someone was just
Yes. In 1893, he
Wow.
performed one of the first successful open heart surgeries.
someone was just telling me about a friend of ours. She went in for surgery, and they took her heart out.
Mm.
Wow.
Yeah, that's that's kind of yeah. But all heart surgery is not open heart surgery.
Right.
Open heart surgery is when they actually open up the heart. Usually, when they do that, they're dealing with the valves.
So I envision it's like they open your chest, but no, it's
Oh, they do have to open your chest.
Yeah.
Yes. So that means
And
cracking that and spreading it out. Yeah. It's not fun.
Mhm. That's why.
Uh-huh.
But, but they've come a long
They have.
way.
They have.
They can actually.
every karate movie where you saw
Yeah.
they go in,
And they're yes, the surgeries are quicker.
or you go home. What 2-3 days? after
Oh,
open heart?
well, you're going to stand up that day.
Mhm.
You're going to
Okay.
be stood up at the bedside, no matter how big of a job
Mhm.
was. That's you're going to be up and up.
They have to put you through a heart lung machine that bypasses the heart, and so your blood is going through this machine, and that's what caused a lot of the problems because it really beat up on the cells. And so they're able to do things much more efficient and faster now. And so you're able to stand up faster and recuperate faster. And a lot of times they don't even have to open you up. They can do a lot with the angioplasty, and they can even change the valves now
No, right.
without opening you up. They just put it in there. And
So it
it
sounds like a
pops.
car. Yeah,
Yeah, yeah.
we're gonna
Yes.
pop out a
Got
couple
to pull
of
that whole
valves.
engine out. What? Can't you just go through here? That's what they do with my heart. They didn't have to take
We
it all the
talk
way
about
out.
when you put it back. Shouldn't that be going there?
Right.
If I didn't need it, why did it come with it?
Right. Yeah, it does make sense.
One of the things I'm always fearful of is clogged arteries. Talk about what are the causes of clogged arteries.
Well, a big cause is the food that we put into our mouth.
Wah, 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 wah.
Yes. Sorry to say. The high fatty foods and those things with different types of unhealthy fats, animal fats, trans fat, things like that. So you mean you can still eat everything really. It's just those things that are really fatty. And that includes not just animals. We're talking a lot of our pastries, things like that contain a lot of fat in them. Can clog your arteries. So,
But
mhm.
we have cholesterol lowering medication.
Yes, we do.
And someone called me like, I don't want to be started on this med. I don't want to be started.
I just had that same conversation with somebody.
I'm like eat the cake, anime. I'm like,
Right.
take the medicine.
Right. It's like, why is that so hard?
Okay.
And I will say to people, if you've been on a statin, which is the first line most commonly used, if you have issues with it, because some people do, you talk to your doctor. You don't stop taking it
Right.
because there are other statins that may not give you those same side effects. And if it's all statins, then there's another line of drugs that will help. But your cholesterol
Either way,
is
you don't
going to
eat the
kill
cake.
you. That's right. You better eat it. Otherwise, you're going to have these heart attacks,
Yes.
strokes.
Yes.
When I talked about, arteries being clogged and it affects the brain can't function. Even if you haven't had a stroke yet, the fact that those arteries are clogged means there's less oxygen getting to the brain.
when statins came out, that was a game changer.
Mm-hmm.
That was a game changer.
And nowadays, so many people are on statins. And I had a friend talk to me last year. We were going through her meds. And she says, I don't know why I'm on this. My cholesterol's fine. It always has been. But she's got diabetes and some other health issues. So I had to explain to her, sometimes your numbers may be normal, but based on family history and other diseases you have, we want to keep that a lot lower than what we look at as okay for an otherwise healthy person. So take the statin.
First time ever, I did oxtails.
You felt it?
No, I didn't feel it, but
that's what you kept thinking was like,
oh my God.
My arteries are all clogged up.
But it tastes so good.
It does.
Oh, it's so rich and
fatty.
Fatty.
Once a year, maybe.
Yeah, that's the thing. Even beef, I know with the new dietary guidelines, there's some pros and cons with it. It does focus on whole foods, which is important, but you still need to limit those fatty meats like beef, pork, veal, twice a week, maybe tops. But not every day. Some people, are beef eaters. I think my dad ate beef, 8 days a week, even though there was only 7. Yes, he was a farmer.
8 days a week.
He ate it 8 days a week.
You had a caller that just called and wanted to know, is there any way that you can tell if your arteries are clogged?
Yes, there's a blood test that is done.
Okay.
And that will identify what's going on. If there are other issues that are more serious, there's different labs. They can do Doppler ultrasounds, they can do other testing to see, but either way, you have to visit a doctor.
So there's no like swelling or anything that would take place in the body to alert you if you are having.
No, because that swelling could be
from anything.
Anything. Sometimes your elevated blood pressure could be a sign that your arteries are clogged, because if they're clogged with cholesterol, then there's not enough room in there. So your heart has to work a lot harder to push that blood through those vessels.
And, speaking of Black history, we must, we always tell people there are certain things you can change through lifestyle change, and there are certain things you can't. And one of the things you can't change is your nationality or your race.
Mm-hmm.
And
your genetics.
And we were taken out of our country, put on the ship, and brought to America. And the slaves that survived were the slaves that were salt retainers, because the other ones died of
dysentery,
dehydration, whatever. So when we got to America, we made it with other slaves, and it's not. Some of us do, but it's not that we eat too much salt. It's just that we're more salt resistant. We should eat less salt
because our bodies are much more sensitive to it.
That's it.
Yeah,
our bodies are, and it ain't our fault.
Right. And
it always gets back to slavery.
And
we say it all the time, but it always gets back to slavery.
And it may not be our fault, but we still have to do something about it, right?
But if you don't know it,
exactly.
If you don't know it, and you go to the doctor, and the doctor go, you African Americans, y'all blood pressure's so high.
Excuse me?
It's an insult.
That's what I'm saying.
When he said you people, excuse me?
And then that makes you feel some kind of way.
Oh, sure.
And
it makes you feel like you want to hurt somebody too.
Well, and you feel like, well, I got it anyway. But no, because we've taken how many blood pressures in the community, and a lot of time men, they really get more defeated quicker than the women do when their blood pressures are high, because men fixate more on numbers than women do. Yeah, y'all want to know the number. What's my number? What's normal?
Ain't gonna do nothing but tell me the number.
Want to know the number.
You know why?
Why?
So we at the barber shop.
So you can talk, man, let me tell you what my numbers is.
Statistically correct when I'm having this conversation. That's one of the processes of you walk up, Brenda, how you doing? And Brenda pulls out her medical chart. This is the process when you get older. Keith, how you doing? Well, and then we tell you. I'm like, dude, I don't really
want it. I didn't really
your
want
medical
all of that.
history. This was more of an esoteric
Yeah.
question, like
Just how you doing?
how
Like
you
being
doing? How's
kind,
life?
right?
I
Good
mean,
to see you.
Oh man, I tell the story, man. I went to. That's why I don't go to Super Bowl parties. And these brothers talked 30 minutes about gout. I know my boy listening. They 30. I was going like, "There's a game,"
but my
they're arguing about it. I'm like, "Come on,
Which
man!"
is different to everybody. Every personal
and
gout is different,
and it's painful. It's bad. It's painful.
What about we hear this term congested heart failure.
Mm-hmm.
What is the definition of congested heart failure?
It is truly congestive heart failure when your heart is not pumping effectively, and your heart on the left side, it pushes all the blood out, and it does it so forcefully. But if things aren't working properly, because the blood got to come back and go into the lungs, your heart and into the lungs and come back out, you can get where you get extra fluid. The heart is not functioning
and it's
properly, and so you get a backup of fluid.
mm-hmm.
And they can tell. They used to, now they have a blood test that they can do right away that can tell if you're in congestive heart failure. Back in the day, they didn't have it. They went with the symptoms and the chest X-rays and things like that. But now they can draw a lab and they'll say, she's in congestive heart failure.
I mean, you might, depending on what part of the heart is really affected. I mean, you could have a lot of swelling in your extremities, especially your lower extremities, like Julie, so that body's not able to bring that all the way back up. You might have rattling in your chest because you're getting fluid in your lungs. But you think about like your muscles when they're big, they seem to be working really well, and you want them strong because then you can lift more. But when your heart gets big and flabby, that muscle is weak. And as a result, it doesn't have the ability to pump that blood effectively throughout the body. And so it can be life-threatening. Nowadays, there are treatments, but that doesn't take away the heart damage, but it can provide some relief. But you got to take your meds because a lot of people, once they feel better, they stop taking their meds.
Or they go to church and they don't want to have to go to the bathroom.
Yeah, so they don't want to
take their water pills.
Mm-hmm.
Can I have a question?
Yes.
What causes irregular heartbeat?
Now, we always talk about the heart as far as you have the plumber part where the blood vessels can get clogged, like your
Mm-hmm.
sinks. Then you have the electrical part, and the irregular heart rate deals more with the electrical part of the heart.
So you have like a little node in there that fires off and controls the heart rate. And if that is defective or it's not working properly, then you might have irregular heart rate,
fast,
slow,
or deadly.
Mm-hmm. Or it can be boom, 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 stop, boom, stop, boom, boom, boom,
and
stop.
that could be normal,
right?
But if it's like atrial fib, that is one that can cause you to. First of all, they want to put you on a blood thinner. Because you can throw a clot.
Mm-hmm. And then that could be deadly.
Is that good if they put you on the blood?
Oh, gosh, yes. Yeah, that helps to prevent the clots from forming and being sent out to the body that can cause strokes, heart attacks.
Yes.
Okay.
Well, I have a message. It says, tell our sister healthcare professionals the substitute programming was done well and professionally, but could not replace our two resident experts. Happy New Year.
Oh, thank you. We are so happy to be back.
And I must say though, you talked about the in-hospital nurses that work in the hospital. I was in the hospital caring for someone that had surgery there, and It's amazing. The machines that they
Oh,
have
the technology
now
they
and
have nowadays.
the
Yeah.
things that they do now, and I be going, I'm like, what is this?
Yes.
I feel ancient when I go in the hospital. And the person I was with, like, she's a nurse. I said, don't tell them that. Don't
Because I don't know even what that machine's doing
But
over there. Yeah.
the psychology of all of that, you're sitting there looking at the monitors.
Mhm.
And then, there's a couple of things that I just have to, because, either you or someone's in the hospital.
Mhm.
And it was like when we had taken mom to the ER last year, and the hospitalist was talking to her. He said, "How you doing?" She said, "Not good if I'm here."
Right.
Folks, we
Right. Always got something to come back with.
But no, but I think, in terms of as a loved one, you're looking there, and then you have to learn how to put things in perspective. One, we're not in ICU.
Mm-hmm.
Two, they're not overly alarmed.
Mm-hmm.
Okay, but every little thing, that blood pressure,
Yeah.
yeah, you going like, oh, but they're not tripping.
Yeah.
So
And that's part of one of the things, probably the most important thing that a nurse has to have is critical thinking skills. You can learn how to do all the different skills, those are tasks, but to be able to, and this equipment, how all the new equipment, it helps. You got to take in that big picture, and you're constantly assessing what's going on and using your critical thinking skills. You got to know when to call the doctor, what to get from this machine, how that relates, what's that clinical picture look like of that patient. Those are the things that you don't always see, and that's why maybe when you see, you're alarmed, but they're not too alarmed because they've got the big picture, and they're constantly assessing that. Right. Well, yeah, as a person with somebody, that's what you do. When my son was in the hospital, I slept next to his bed 24/7 for the most part. He slept too because he was so out of it. He
right.
didn't know what
It's
was
like
going on.
we sit out there and look at my mama. She's just sleeping. I mean, it's like, you can go home.
And if you could get that feel that they got this under control, because family do need to go home and rest, because when they come home is when the work is gonna you're gonna need to have been rested, so that you could provide the care.
And wow, now things can happen. We got a call. Caller, welcome to the program. I'm getting ready to babble. Caller, welcome to the program.
Well, thank you. Make it worth the wait then. Good morning, Mr. Ryder. Good morning, ladies.
Tyrone,
Good morning.
Did
Good
I
morning,
hear you on Al Sharpton yesterday?
Yeah, indeed, you did.
Okay.
I heard him too.
Well, I'm glad you did. Well, anyway, long story short, to not want to suck the air out the last minutes of the show here, you were talking to the open heart surgeon. I just wanted to, telepathy is amazing because you were just speaking machinery, and that leads right into my whole the filtering of the filtering of the blood should be the key to all of that, because if that filtering isn't any good, then you're pumping contaminated blood back into a restored heart. And you may remember during COVID or Corona the ventilators. I heard stories that, oh man, the ventilator's not really doing any good because the air, I don't know if dust, but the air wasn't quality air. I mean, so it's almost like if he wasn't breathing dust there, it's almost like he was, the air quality just wasn't good enough for him to be breathing, even coming through the ventilator. I'll tell you very quickly, and I'll leave with this. I've broken air conditioners down, and I've seen some nasty air conditioners, spiders in there. I'm like, man, take the thing out and wash it at least every 6 months or something. So, the filtering has got to be the key to pretty much all of that then. And I'll listen to you over the air then. Thank you very much. Welcome to the new year.
Happy New Year.
That earpiece, Legionnaire's disease. But people are sourcing it to the air system in that hotel, because it started at this particular hotel.
Correct.
And in Philadelphia, but they looked at that as one of the possible culprits was the filtration. But look, in the hospital, I mean, though you all pointed out to me that, and you've seen it, I noticed that even when I went out to Aurora and when I was at Freighter, that hospital people were wearing masks.
Mhm.
And because, as you said, infections are.
Right.
Mhm.
Yeah.
And in the hospital, you do have a couple. You have two different types of, positive pressure and negative pressure air, depending on the type of room, type of patient. But yes, it does go through like a filtration. But yeah, there's always people coming in, air coming in from the outside. And then, of course, infections that are transmitted through droplets or respiratory. And so, but that first case of Legionnaires, when they first discovered it, it was a hot mess. Got into that ventilation system. A lot of people died. It's a lot of political. It was a
Yeah,
It
it,
was-
it
yeah,
got
it was-
bad,
it
and
was
they
all-
ended up, and the crazy thing was
senators and
Philadelphia only really had one or two downtown hotels,
Mhm.
and that was, I think, it was the Stratford. That was, and the only reason I knew about Legionnaires, but also I recruited in Philadelphia, so obviously I would stay in hotels, but they ended up having to close that down to be able to go in.
Yeah, there was a recent case of Legionnaires. I don't remember
Yeah.
where that was. That was just in the last couple months.
I do want to say that ventilators are safe, and respiratory therapists are super intelligent.
Oh, they're awesome.
And respiratory docs are very, very intelligent, and usually, different specialties have different personalities,
Mhm.
and respiratory docs are usually very laid back and kind
Mhm.
and understandable.
I know when the chief cardiologist, they were doing rounds at the residence, they were coming around, and that's when I'd had the stroke, and so he comes in and he looks at me, Indian gentleman. He said, "You smoke?" I go, "Yeah." And he goes, "Do you want to live?"
Yeah, I was gonna say cardiology play.
Like, okay, great bedside
they're
manner.
right-
Just kind of set me up
Right
for
to the
this.
point.
Right to the point. You're gonna die.
Mhm.
Caller, welcome to the program.
Yes. You got a minute, Keith?
No.
Okay. The reason I'm calling is that my name is Charles, last name Grady, Vietnam veteran, had all kinds of health problems as far as joints and stuff.
Mhm.
But have you all heard about garlic clove as far as high blood pressure? Garlic clove.
Yeah, a lot of people do garlic
Yes.
for blood pressure, but the medicine is better.
I'm going to throw it out at you. A couple of years ago, my cousin moved into my complex, and he threw it out at us to use the garlic clove because his pressure had been down for years, and mine was like about 150 or 60 something at the time. And I started on it in about 2.5 months. My blood pressure went down, and it's been down ever since. And you don't have to do it every day after you start getting it down. You can do it like every few days.
You're doing a garlic supplement?
No, it's a garlic clove. You buy the clove from the store,
Okay.
the grocery store, and you chop it up real fine.
Okay.
And a lot of people can't take it with water. They have to use juice or milk when they first start till they get used to it. But all my doctors and nurses say the same thing. We need to try that because mine been down for over 2 years now, like about 120.
Okay.
I'm just throwing it out at you.
I just thought it was for vampires.
Believe me, it works.
No, actually, I cook a lot because a lot of the recipes call for garlic.
But in the medication, hypertensive medication is very effective also. And how much garlic do you have to take? And does this person take the same amount of garlic as the other person? When we know scientifically that it has been proven that antihypertensives are effective. And I would I know a lot of people that would do garlic and what was that for diabetes there?
Cinnamon,
Green
apples.
and all this when we know we have medication. And really antihypertensive medication is not expensive. It is reasonably priced, and it can lower your blood pressure. And not only does it lower your blood pressure, but a lot of times it can this would make people take it. It'll make you lose weight because it will take all the extra water off of you, and you won't have all that water weight on you. and it'll lower your blood pressure while it's getting rid of all that extra fluid.
Yes. Could I say this?
Yeah.
Continue to take your blood pressure medication along with the garlic clove.
Mhm.
I agree with you. If
Yes.
that's what you want to do,
Yeah.
that
Yes.
is fine. Do both.
And it
That
works.
is nice. Thank you. That's
All
nice.
right. You're welcome.
Hmm.
What about
Bye-bye.
and maybe we can do this. We have a couple callers, but then Brent, I want to talk about AFib because people were talking about irregular heartbeats. I thought about Jamar Hamlin, who, if not the freakiest injury ever of all time in sports, this was where my understanding was when the hit happened, it was between heartbeats, and it just threw off everything.
Yeah.
Yeah.
Yeah. That electrical part of his heart that
You're
we talked
listening.
about.
You're listening to Community Voice from Inside Be Healthy, Be You. They're back. Take a quick break. We'll be right back. Questions in the chat. So, Brenda, I know you're closest.
Closest. Whoops. Where's the one?
Yep.
Up. You hit it. Oh, we're okay. Can you ask my? Okay, you got to scroll down or something. Nurses strike and sertraline meds. I don't know a whole lot about the nurses strike. We were just talking about it, other than it's still going on. Do either you guys have anything?
I just know in New York City, it's in New York. Yep.
And I'm gonna tell you, when we were coming up, we would never have struck. We didn't even have unions. We were told that it was, that it was a call and not a job, and we did whatever we were told to do.
Right, we're making $9 an hour.
We did whatever they told us to do. We did it, and so when I see the young people nowadays, and I'm like, it's a different era.
Yeah, because we would have, again in our era, felt incredibly guilty for the patients.
Yeah, no way we had walked off the job.
Yeah, and then the other one was sertraline, which is a SUI, which is a drug that's often used to treat like anxiety, depression, and I don't know what else to say about it, but that's what it's usually used for. It affects the serotonin levels in the brain, and that's how it works.
I wanted to. Can you tell us a little bit of what is afibrillation and what that is?
Atrial fibrillation, the top of your heart is called the atrium, the bottom is the ventricular. So when you have atrial fibrillation, is when your heart is not regular, it's irregular, and because of that, you're not getting all the adequate blood out of your ejection fraction is not where it should be, but also it gives the blood time enough to pool and could throw clots. So because of it being atrial fibrillation, there are ways that they can, sometimes we call it electrophysiology. They can do certain things to shock the heart and get it back into a normal rhythm or slow it down. When atrial fib is dangerous is when the rate is super, super fast. They slow it down. They're okay with that. But when your bottom part of your heart is fibrillating, that's a death sentence and dangerous. And that's called ventricular fibrillation. And that's what we shock. That's why we shock it, to try and get it out of that dangerous rhythm. But AFib is treatable. And the biggest thing is they want to do is they'll slow it down and they'll put you on blood thinners.
And they can do that with medications.
So I've used this term and maybe I shouldn't. Is it curable or is it treatable?
It's treatable.
Treatable.
So once you have been diagnosed, you pretty much.
Some people go back into a normal sinus rhythm after the EFIS study is done, but some people don't. But they're still at risk of going back. So it's always something that they have to watch. Nowadays, sometimes either after they've verted you or put you on meds, they might have you wear a monitor at home, and then they can see all that information to see if you're going in and out of, because some people go in and out of
that
AFib.
monitor, and I don't even know if I sent the results back. I didn't die. Okay.
Mhm. Yeah. But
But
for some people, it helps them to know if they're going in and out,
Mhm.
mhm.
and not staying stable, because you may not necessarily feel it until it gets really fast.
Did you feel it? Did you
Y-
feel
I
it, Fred?
don't. I think they was just monitoring
Oh, just
everything
trying to
after
Oh,
post
okay.
monitor you.
stroke.
Some people,
Yeah.
some people feel the fibrillation
Oh,
and it
yeah.
doesn't feel good.
What about people? What does a pacemaker do?
Pacemaker. A pacemaker will make sure that your heart beats at a specific rate,
Mhm.
and they can set it. It's usually 60.
Yeah, it's usually in the 60s. Also, nowadays, people have defibrillators in too, not just pacers. So that pacer may set the rate, but they have an internal defibrillator. If their heart goes out of serious rhythm or it shocks them. And does not feel good when it happens, but it's necessary. Otherwise, a lot of people would just have sudden cardiac death.
Tyrone Dumas had put in the chat. He was talking about how ventilators had saved a lot of lives during COVID.
Ventilators are awesome.
Mhm.
And I worked a lot with ventilators. And like I said, the respiratory therapists are there. They tell, they set the machine on how your tidal volume is going to be and how your rate is going to be, and they set it all according to you, specifically according to your body and your disease. But they wean you off of it, and some people have to be on vents for a long term. Some people don't. They can wean you off of it, but ventilator is life saving.
Hmm. And during COVID, we would not have survived without the respiratory therapists. They were the ones that were managing those patients at the bedside. The nurses helped, but those respiratory therapists are the ones that really manage those ventilator patients.
So, people, would you also have something? Is it possible that I'm on a ventilator, but I'm also dealing with something to help my heartbeat?
Mm-hmm.
Oh yeah, you might need a lot of supportive care. So the heart, and in during COVID, sometimes they had to bypass the lungs altogether with what they called ECMO, because the lungs were so inflamed and damaged. So in respiratory therapists, again, that was their baby.
In intensive care, you could have where you have just one nurse taking care of you because you got so many machines going on. It could be that complicated. And then you got a nurse and a respiratory therapist, and you may have a dialysis person there. And you're fighting.
So you're making sure the kidneys are working, make sure the heart is working, make sure the lungs are working, one can breathe.
So you can imagine how intense that is. You have 3 people that are working one-on-one with one patient just to keep them, providing all that supportive care to keep them alive until their body can heal.
Anything else there in the chat? That I know people are they're chiming in. I know some folks are trying to call. No, got something there? Okay.
It's very important to heart disease still is the number one killer. I know people that say, I jog 5 miles a day. But the guy came up to me and he said, I jog 5 miles a day, but I'm starting to feel this pain in my arm. And I'm like, that's why runners usually just drop dead.
Right, because they ignore it. They think I'm so healthy. This has nothing to do with my heart. It's a muscle. It's something. But just because you're thin and you might eat healthy, you might do everything right. That doesn't mean that you can't
Jim
have a heart
Quick,
attack.
Who was the guy who really people give credit for really popularizing jogging. He had been a smoker many years, quit smoking, got in incredible shape. He still died from heart disease.
Right. And that's what I'm saying. You need to start with your primary care physician. If you have to have a heart doctor, that's usually a cardiologist, and you need to go to your cardiologist, get your checkups, follow what they tell you to. If your blood pressure causes lots of damage. But there's so many different types of medications out there that they will get your blood pressure down if you do the lifestyle changes that you need to do, watch your weight, stop smoking, and take your medication.
Yeah, and I had a pulmonologist tell me that if you're on three classes of drugs, they probably need to evaluate you for sleep apnea, because the majority of the people that have to be that heavily regulated probably have some sleep apnea that needs to be treated, because sleep apnea, can kill you, raise your blood pressure.
What is sleep apnea?
It's basically when a lot of people, some people that snore have sleep apnea. It's when you're really just not oxygenating. You may stop breathing during the night. And people think loud snoring is definitely something that needs to be evaluated. I remember Reggie White died from sleep apnea. It does incredible damage to your heart. People who are overweight, have heavy necks, that snore. Sometimes that sleep apnea can be significantly improved by losing weight.
A lot of us snore, though, right?
A lot of, but it still is not normal. Snoring is not normal, and you can snore because of issues in your throat. You can snore because it's nasally. There's something narrowed nasal passages. There's a variety of reasons, but if you're snoring and you occasionally stop breathing, that's serious. And people who use those, sleep machines, apnea machines, a lot of people say, oh, I could never sleep with that on. Well, when people sleep with those, they're like, oh my God, I slept like a baby the minute I put it on. And it needs to be adjusted. Sometimes they need to be adjusted. You might need a different type of mask. There's a variety of things, but just don't give up on it, because you're talking about not just sleeping. You're talking about you're talking about life. Like I said, the machines have come. They're very different than they were 10 years ago, 20 years ago. They're small. Some don't cover the whole face. There's a lot of different things, but certainly, if you are having issues like that, you're snoring heavily, you should let your doctor know.
Yeah, I actually had to have surgery on my deviated septum.
Deviated
I
septum.
had my adenoids removed and my tonsils, because I used to snore real bad, but I had the weight on me as well. So I went in for the sleep study, and the doctors told me in an 8-hour period of time, I stopped breathing 450 times. And this was every night. So I had no clue. And I'm thinking that I'm getting the proper rest, but I wasn't. So I would fall asleep during the day, or I'd be talking to you and fall asleep. And, I actually almost got fired from church. I was on the organ playing at church, and I would fall asleep. Whatever, but they thought it was from me just being out hanging out.
Yeah, that's what they say with Saturday
night.
But
that's a big thing, because
the day after the night before.
So they thought I was out hanging out, but it wasn't. So I'm on the organ fighting it.
Yeah.
I would feel it coming, but I couldn't control it. So I would pass out, but I can still hear.
Yeah.
I can still hear what's going on. So I was able to kind of catch it, but I'm falling asleep. And I had the CPAP machine. They gave me the machine. And I went home and tried it. And it's like getting on the freeway, going 90 miles an hour, roll your window down and open your mouth and stick your head out.
Oh, the new ones are so quiet. You don't even hear them. Okay.
But it was just the pressure.
Oh, the pressure.
Yeah, so it was the pressure. So how they had mine set at 10, and then they lowered it to 7. But it was still the pressure of it. It was still too much. So I pulled it off, and I decided, I was like, I'm going to the gym. I'm going to lose the weight. So by me losing the weight, I don't have that issue. Like I had.
Yeah, that was
terrible. I was in heart attack, stroke range.
Yeah, being overweight is really a risk factor. Yeah. And then I'm glad you said that, you felt like you were sleeping through the night.
Yeah.
Because people say, oh, I had a good night's sleep, but you stop breathing so many times. In the next day you're exhausted. You're like, why am I always exhausted when I sleep so well at night?
Yeah,
because you're not sleeping.
And it was crazy, because when they did the study and put the machine on me, I remember how I felt that next morning. And when I woke up, I actually woke up at like 6 o'clock that morning, but I was energetic.
Yeah.
I had energy. I was like, man, I feel like I'm 14, 15 years old again. But didn't realize that I was missing at all of
Yes.
those years
Yes.
until it hit. So I was like, that's
That's how you're supposed to
that's
feel.
how I'm supposed to feel.
Mhm.
But it was like, people just thought I was just out kicking it. So I'm falling asleep on the job and things like that. But it was something I couldn't control.
And that happens a lot. People falling asleep,
Yeah.
thinking they're, and people don't realize often how sick they are until, like you said, all of a
Yeah.
sudden, wow, I feel great. I didn't know I could
Yeah.
feel like this. That's how you're supposed to feel. But because you just normalized
Yeah.
how you felt before,
Yeah.
because you thought, well, that's just it. That's
Yeah.
how I'm supposed to feel.
Yeah.
But it's not.
Yeah.
Well,
That's true.
again, February is Heart Health Month.
Black History Month.
Black History Month. Yep.
No, you talk in your family about the different diseases that are in your family, or what aunt,
Mhm.
uncle, mama, grandpa died from, or with, so that you can be aware.
Mm-hmm.
And those of us who are eligible, part of one of the things, and I know I have a lot of Medicare listeners out here, take advantage of your health screening, your checkups,
Mhm.
go in and see what's going on. And I know the fear, like they're going to find something. But
Mm-hmm.
the sooner they find it, if they find anything, the better off in terms of
Treat
treatment.
you.
Yeah.
Mhm.
All right. Well, be healthy, be you. Welcome back.
It's very
Again,
good to be back.
Miss Julie Means, Miss Brenda Buchanan. Let me thank Clark Kent, Debo, Jermaine, all the callers,
Yes.
and even some of the people who text and hate. Thank you.
Yes.
Yes. Lots of people. That's awesome.
Yeah, like somebody was talking about. I don't eat that much bacon. I don't eat that much bacon. I
Somebody must have saw you eating some.
no. We was talking about get off the pork, and I was going. I don't eat that much bacon. I'm gonna tell you something that's just hard to quit. Honey baked ham, Lord, sweet Jesus, Lord, black
It
Jesus.
is delicious. Their
It-
turkey is delicious too. Have you ever
Yeah.
tried that? That's
Yes, the
delicious
turkey.
So
too.
is that process?
No.
It's cooked different.
Yeah.
Yeah.
Mhm.
Yeah. That,
So we won't get into that. That we do that next month. All right. Yeah. Thank you all. Good seeing you.
Yes.
Welcome back.
Be back.
Yeah.
Welcome
Thank you.
back.
Thank you.
I
Thank
love
you.
my black people.
yeah, we
I
love
love
you
all
too.
people.
I love all people.
Just your black people?
Black people.
What about everybody else's black people? You don't love everybody else. It's just your black people.
Debo's like, let me get out of here.
If you're one of Julia's black people, please let me
Raise your hand, please.
raise your hand. Let me thank everybody. Hey, y'all, the good Lord willing, creek don't rise. Hope to talk to everybody tomorrow. And as always, go from this place in peace.